The past few weeks witnessed a drastic increase in the registration of new confirmed cases with coronavirus in the Sultanate, and thus the medical teams across the country exert extensive efforts to provide the needed attention, especially for the hospitalized cases, as more of them require further intensive care.
Unfortunately, the number of COVID-19 has increased dramatically in the recent, I will say, weeks, and this is internationally and locally as well. Here in Khola Hospital, we do receive a patient under an intensive care unit, and mainly those patients are those patients with chronic diseases like diabetes mellitus and high blood pressure, and also those with chronic kidney disease.
Although all age groups are at risk of contracting COVID 19, older people are more prone to losing their fight with the virus. According to recent statistics released by the Ministry of Health, most COVID 19 fatalities have been among people in their 60s.
Usually our patients here are aged between 25 to around 82 years old, and usually they are having some chronic diseases like hypertension, diabetes. Actually what we have noticed that most of these patients who who require ICU admissions at least, those they usually come from or they got this disease by social gathering, and they got it from the community. We do advise our people really to stick to the protection measures, like wearing masks and to keep their hand hygiene and social distancing.
The increase in the new confirmed cases set an alarm not only for the medical teams, but also for the whole community. And as the blessed Eid al-Adha is approaching, people should observe physical and social distancing and wearing masks to stop transmission of the virus. As the number of COVID 19 cases is on the rise, we need to firmly stand together to adhere to the precautionary measures in order to curb the spread of the virus. From Khawla Hospital, Saleh Al Rahbi, Muscat.